Hi everyone, this is Dr. Waring Scott. I am here today to talk about the foaling basics. So this is really good information for people who have brood mares that they're going to be foaling out, either if it's your first time having a foal, or you've had many foals, or you used to have a bunch of foals and now you're coming back into it, or if you even have a friend that has a brood mare. It's good information to have. So I made a blog post about it, and I'm just going to kind of go over some of the basics of the post and see if there's anyone out there that has any questions that I'm happy to answer. So first of all, if you have a pregnant mare, you have to figure out when that mare is actually going to foal. So the average time for a gestation period is 11 months and 11 days, is kind of the old colloquial saying that I grew up saying, but if you want to put a number to it, that is 340 days. Now, if you want to be very specific, it's 340 days post-ovulation, not post-breeding. So sometimes you can breed a mare and she won't ovulate until a few days later and she can still get pregnant. That 340 days is based on the day when that egg is actually released. It's 340 days from there, so you will need to get an ultrasound diagnosis to get the exact date if you want to be kind of specific down to the day. You can still do a general 340-day estimate from the day that they're bred. It just won't be exactly to the day. But that's okay because the 340 days is pretty much just an estimate. There's plenty of mares that go before that. There's plenty of mares that go after that. It is just an estimate that we like to keep in the back of our head. So talking about mares that go before 340, if they go before 340 but after day 320, then we are still in a safe zone. Those are some mares that just go a little bit earlier, and that's totally fine. If you have a mare that gives birth before day 320, that is considered a premature foal. So premature foals can come with a whole lot of health problems. They might look okay when they're born, although generally a lot of them will be kind of a little bit weak looking. They might have some issues standing, they might have issues nursing, but the most important thing is that if they're truly premature or before 320 days, they're going to have some internal health issues that aren't exactly visible from the outside. Their bones in their knees and their hocks are one of the last things to actually mineralize. So if they're born early, sometimes those bones are just kind of, they aren't there, they're just still some cartilage spots, or they're essentially very soft. So we have to take x-rays of those areas to make sure that they're fully developed. If they're born very premature, then they might have actually difficulty breathing because the surfactant in the lungs, which is what helps with the air exchange, is one of the last things to develop. So very premature foal could have some best case scenario, just some issues with their bones, and they need to be on restricted exercise for a while to prevent, we call it cuboidal bone crushing, or kind of worst case scenario, they might need full hospitalization because they might actually be having a problem breathing. So usually the premature foals are the ones that are a little bit of a surprise because people aren't expecting them before that time. But on the opposite side, we do get some calls occasionally that say, oh, my mare was due to foal this week and she hasn't foaled yet. Can you come out to check to make sure everything's okay? And we're happy to come out and make sure the mare is still pregnant, that the foal still has a heartbeat. It is possible sometimes for mares to lose their foal at some point throughout the season and actually not be pregnant anymore and just have a big hay belly and people don't realize it. But if the foal's still in there and the foal's heart is still beating and everything else looks okay, we really don't do much about it. Inducing labor in a mare is not really a thing unless there's some very unique medical situation that requires it, but that's very, very rare. We kind of have a saying that they'll be ready when they're ready, and when the foal is fully developed and ready to come out, then she will have the foal. If it was a foal that is overdue due to something called vescutoxicosis, which is where the pregnant mares eat fescue grass that kind of basically has essentially a type of mold or an endophyte on it, that can cause abnormalities of the reproductive tract, including overdue gestation, and then they also have other issues like they sometimes won't actually create milk when they're born, so they have to be on a medication to stimulate milk production, and sometimes those mares are at risk of slightly more difficult foaling just from general overall reproductive abnormalities, that everything, maybe the uterine muscles aren't going to contract correctly to get the foal properly positioned. So unless you have a strong suspicion that your mare has been exposed to fescue and that is why they haven't foaled, then we generally don't get too concerned if they're overdue. So now that we have kind of our day 340 mark, that we are kind of getting ready, and I recommend that people start keeping an eye on their mare at day 320 and starting to really note what's normal for them, what's abnormal for them, because as I say, they can go from anywhere from 320 up to 360. But there are some things that you want to keep an eye on that might give you an idea that things are starting to kind of get close to that time. So if you keep an eye on their udder, they generally start to get their a little bit more fill to their udder anywhere from up to a month before or like 2 weeks before. So that's definitely something to keep an eye on. They'll go from having a very small, almost shrunken udder to start getting some fill. And then as they get up into the week before it, then they'll actually start to get fill in the actual nipples, and the nipples might start to kind of point outwards because they're starting to get full. You can look at their region around their tail head, up where their tail attaches, and kind of around the whole hindquarter area. They start to get what we call relaxation of those ligaments. So the tail head and muscles might look a little bit dropped and a little bit more flattened. Their vulva might look a little bit more elongated. And that usually happens a day or two before foaling. It's obvious in some mares, it's not obvious in other mares, but it's something to look at, which is again why it's very important to know what your mare looks like normally, and then you can kind of see those changes if you're kind of taking note for them. One of the things that a lot of people are used to looking for is what we call waxing. So when the mare is getting very close to foaling, they will start to get a little bit of that first milk. The colostrum starts to accumulate kind of a waxy secretion on the tips of the nipples, and they almost look like little white icicles, and we call that waxing. And about 90% of mares will foal within 24 to 48 hours after developing that wax. So if you go out and check your mare and you see that, then you know her time is coming up pretty darn soon. So if you're having some problems kind of keeping track of, is the mare waxing? Not all mares do. Not all mares will get mammary development as well. Then we have some other kind of more advanced tests to help us get a much more specific timeline. And the ones that are really common are testing the milk calcium. So it's not technically their full milk yet, kind of like their pre-milk mammary secretions. You can milk out a little bit with of the secretions or kind of early milk into a cup, and there's some commercially available kits out there such as Foal Watch, Predictafol. Essentially, we know they've done a bunch of research and they have found that when their milk calcium starts to rise, so when it goes above 200 parts per million, there's a 50% chance she'll foal within the next 24 hours. So some people in like some foaling operations where they're monitoring multiple foals, they'll have a list of all the mares, all of their milk calcium, and as soon as they get above 200, then they go on official Foal Watch, which means that they're thinking about becoming pregnant, or they're thinking about foaling, so then they go under much closer scrutiny and start to go under 24-hour monitoring. So what we're looking for when we're monitoring these mares, because it's very important that these mares are monitored for their foaling and not just kind of like left out in a field or left out in a stall and kind of left to their own devices. Usually the majority of foalings are just fine. Horses are lucky in that compared to like cows and sheep and cats and dogs, they really have fewer problems when they foal. They're much less likely to have issues such as a breech birth or stuck leg or hip lock. But when it does go wrong, it goes wrong really, really fast. So unlike a cow, where if you have a calf that's coming out and the calf is stuck, you generally have several hours to kind of help get that calf out, and the calf can be perfectly healthy. Where the way that the horse's placenta is set up, they have very, very small window of time where if something goes wrong and that placenta is not kind of still intact and kind of transferring that oxygen still, they can have literally minutes before it goes from being a healthy foal to a very sick or possibly a dead foal. So that's why we really encourage everyone to monitor, because there's quite a few things that can cause problems with foaling that people can correct. So the biggest thing is knowing when your mare is going to foal and then keeping very, very close eye on them. So what we're looking for is starting of, we call it stage 1 labor. So stage 1 labor is when you start to see all of the behavioral signs of them wanting to foal. So that's when the uterus is kind of starting to get a little kind of contracting, starting to kind of get that foal up into the birthing position. So they might act a little uncomfortable, they might paw, they might get a little sweaty, they may lay down, they may circle, and those, it can mimic signs of colic, but if you know that your mare is getting close to foal, it's more likely that they're getting into stage 1. So those, that can happen from anywhere from a few hours before they foal to up to 24 hours before they foal. But you know once they start showing those behavioral changes that they're coming on pretty soon. So then what I recommend people do when they start noticing that either their milk calcium has gone up or they have, that they're starting to have behavioral changes or they're starting to wax, is get her into a foaling stall if she's not in one already. It's always better to have them in it a little bit early than a little bit late. So a foaling stall has a few criteria. I like them to be, the most important thing is large, clean, and easy to watch. So I want something that's ideally 14 by 14 so that she can lay down comfortably and push when she needs to push and not feel stuck against a corner. And cleanliness is next to godliness when it comes to foaling. That little baby coming out has no immune system yet really, and there's the umbilicus, which can be exposed to bacteria, and they're going to be putting their mouth on things when they're little babies, and that's going to be exposing them to bacteria. So I like a really clean stall. And I do like that to be bedded in straw instead of shavings because it doesn't quite stick as much. So if a wet baby comes out onto shavings, it'll get a bunch of shavings. It'll look like a little powdered donut. But if they get out on the straw, it's much easier to clean the straw off of the wet baby and it won't stick to their umbilicus. So when you know that you're going to be going on full watch, it's important, as I said, to have them monitored 24 hours, which for an owner can get a little exhausting, which is why we try to use these tools to narrow that window down as much as possible. So the milk calcium testing, the predictafol testing, all of that gives you an actual number to go on, so you can limit your full watch from I'm going to watch my mare every single night once she hits day 320 onwards, to I'm just going to have to watch my mare for 1 or 2, maybe 3 nights after she's meeting these marks of the milk calcium and waxing and all of that. But if you are in a situation where you may have to watch them for longer, it's really, really helpful to set up kind of a rotation amongst friends or families or employees that you can have someone that physically has eyes on them all the time. There are different systems out there like the Foal Alert system, and also there's little trackers that you can put on their on their halter that shows if they are laying down or sitting up, and it will alert you if they lay down. But the problem with those is that they're helpful, but they're not foolproof. They're not perfect. So I've been to some dystocias, which is the name for a foaling gone wrong, or foaling that's not progressing normally, and one of them, the baby was fully breech, so it was not going to come out on its own without assistance at all, and there was nothing, the mare was standing, and there was nothing actually coming out of the vulva. So these full alert systems work by taking two little pieces of a magnet that you sew on either side of the vulva, and they stick together. And the theory is when those get split apart, so when the foaling is happening and the baby's coming through, when that device splits apart, they will have like an alert, an alarm will come on. But in order for that alarm to go off, you need something to come through the vulva to split them. So for example, that one foaling that I saw that was breech and the baby was fully backwards, there was nothing actually coming out of the vulva. So a full alert system would not work for that scenario. So it just doesn't catch everything. It's better than nothing, but it's not as good as just having eyes physically on the horse. Camera systems can be very useful to help with not having to stay in the barn, but you still need to have that camera kind of on so you can keep an eye on it, because just kind of periodically checking on the camera, even every hour, that's a really big long time in terms of foaling. When things kind of go wrong, they go wrong quick, which I'll talk about a little bit later. So when you're kind of figuring out how you're going to keep an eye on this mare, if it's going to be a rotation of people watching it, if you're going to set up a foaling alert system, if you're going to have a camera that you're going to have, there's so many nice cameras nowadays online where you can get, as long as you have internet in your barn, you can get a cheap camera that just runs off of Wi-Fi, and you can put an app on your phone or on your computer and you can watch it from anywhere. So I have had some people that will put the camera up there, they stay just kind of at home around, and they just always have that kind of camera there, so they don't have to be sitting in the barn staring at the mare. They can be doing dishes, they can be watching TV, but just having that camera kind of screen that live feed so they know if something's going to happen, they can get up and go out to the barn fast. So it's also a good idea to let your vet know that you are going on foal watch. When I have a client that I know has some mares that they've been that they're expecting them to foal during a certain few week time, I love it when they just give us a call and say, hey, I just checked the milk calcium for Fancy and she is at 400 parts per million, so I think she's going to go tonight. And I'm like, great, I will put a little note in the back of my mind that there's probably going to be a new foal born overnight, and that helps me do two things. It helps me sleep with my phone a little bit louder, a little bit closer to my head, with a pair of work clothes right at the foot of the bed so I can jump up and throw on the clothes and run if I need to, since foaling emergencies can be very time sensitive. It helps me make sure, I take a mental note to double check everything in the truck, make sure I have everything ready to go in case I need to get up and run out in the middle of the night. And also it helps me plan my next day accordingly, because even for healthy, normal foalings, I do very strongly recommend a healthy foal exam, which would take place 8 to 12 hours after they're born. So then I kind of look at my daily schedule and say, okay, if there's a healthy foal born overnight, I don't need to run out to the barn in the middle of the night, but I will need to stop by at some point just to take a look over mom and baby and make sure everything is looking okay. So let your vet know, give us a call. And then I also, as I said, cleanliness is next to godliness in terms of mare and foal care. So you can, don't go crazy with something really harsh or abrasive, but just make sure that the udders are clean and that the vulva is clean. Just kind of really making sure that everything that foal is going to come into contact with doesn't have a high bacterial load that they're going to have to be exposed to. It's also a good idea to put together a little foaling kit to have nearby. A chlorohex solution, which is a disinfectant solution. You could also use tempered iodine or betadine to dip their umbilicus in. So you can get those little like Dixie cups with some the chlorohex solution. Just make sure it's the solution and not the scrub. There's two different types of betadine and two different types of chlorohex. There's a solution, which is the disinfecting liquid, and then there's the scrub, which is the disinfecting soap. So if you get the scrub, it's a little bit thicker, it's a little bit more viscous. If you mix it with water, or if you scrub it on something, it'll bubble and foam up. So that's just not quite as nice as the solution, which is more liquidy, more kind of a water consistency, and it's just a straight disinfectant with no sort of soap agents in it. Vet wrap is always great to have on hand. It's nice sometimes to wrap the mare's tail if you know she's going to foal that night, because it just kind of keeps all that hair away and clean. So when the foal is coming, it's not getting kind of tail hair all over it. A flea enema, which is just a human enema that you can get at the drugstore to have on hand in case the foal doesn't pass its meconium, which we'll talk about in a little bit. Disposable exam gloves in worst case scenario if something is happening that you really need to help and assist with for the mare, having gloves on so everything's staying clean. I have had mares get infections in their uterus post-foaling that they needed assistance, that the owner had to put their bare arm in, and it was just the bacteria from the arm. And the mare ended up being fine, foal was fine. It needed help. Everyone was glad it happened, but it just shows that even what we think of as clean hands can put a lot of bacteria in there. So I do like people to wear gloves if they have to jump in and help. Clean towels, something to just wipe the baby off when it comes out. It's going to be wet. And a clean pair of scissors, which I will talk about shortly. A flashlight or a headlamp if you don't have great lighting in your barn and you need to take a closer look at something, and it's just, those things are always just great to have around. And a notepad for keeping track of what's going on. That is especially useful if you're kind of setting up a rotation of people where you're going to be watching the mare until midnight, and then your neighbor's going to come over and watch her for you from midnight to 6 a.m. There's a little like paper that says she was laying down and pawing at this time. She laid down at this time. She didn't eat her dinner at this time. So it's good just kind of have a nice little step-by-step observation so you can start to see if there's any patterns. So kind of the big moment, so what you're watching for when you're on foal watch is for the mare to move from stage 1 labor, which is, as we talked about, the behavioral changes. They might act a little crampy, they might be laying down, they might be circling, to stage 2. So stage 2 labor is the actual delivery. So stage 2 starts when the mare's water breaks. So just like other mammals, mares will have their water break before the foal is born, and it can sometimes be confused, especially if you're watching it on a camera, like, oh, did she pee or did her water break? So usually when a mare urinates, they'll posture, so they'll kind of stand with their legs a little bit apart, they'll do a little bit of squat, and they'll stick their tail in the air. If there is water or liquid coming out and they're not posturing and they've been in stage 1 kind of doing their behavioral things for a little while, then it is really most likely going to be the water break. And actually one thing that I didn't put on the kit because everyone has cell phones nowadays is what I will even do is have people, the second that water breaks, if they see it, start a timer on your phone, because from the minute that water breaks, that is when things start to get very time sensitive. So that part of the delivery, in order to be considered a normal delivery, needs to happen quite quickly. So if your mare water breaks and their foal is not fully out within 20 minutes, that's considered a dystocia or an abnormal foaling. So there's something going on, there's a leg stuck, they might be too large, they might be twisted. So there's a whole lot of things that could happen, but usually between the water breaking and the baby being fully out is closer to like 10 minutes, but if we get to 20 minutes, then we're starting to look at some serious consequences if that baby doesn't come out soon. So when the baby comes out, the very first thing that you should be seeing is 2 little feet. They're going to have these kind of spongy material on the tip of them. They call them kind of angel slippers, and that's what protects the mare's uterus from being punctured by the hooves. So you'll see 2 little feet coming out, kind of one slightly in front of the other, and a very thin white membrane. And that thin translucent white membrane is called the amnion. So that's very normal. So if you see 2 feet surrounded by a little white membrane, excuse me, that is a normal presentation. The biggest thing that we want to look out for is what's called a red bag delivery. So that's one thing if any broodmare owner takes any sort of key information from it. The red bag delivery, if you're not familiar with it, is one of those big like need to know about, because that's one of those things that can go from being literally a deadly situation for that foal and the foal could die, to you as an observer saving that foal's life very easily. So what happens with a red bag delivery is usually when the foal is born, the placental, we call it the star, breaks open, the fluid comes out, and then the baby comes out wrapped in this thin amnion. When there's a red bag delivery, that placental star doesn't break open. Instead, the entire placenta, which is this entire thick red membrane, will come out all at once. And that's a problem because that placenta being attached to the uterus is what's giving that foal oxygen. So if that detaches too early, then that means automatically that foal is getting no oxygenated blood through that umbilicus. So when they come out, instead of seeing this nice thin membrane, it'll almost look like a red basketball or a dark red round balloon coming out instead of white and thin membrane. Sometimes they can kind of pop the red bag themselves, so it'll start to come out, and then with more pressure, the cervical star will rupture. But it's still very important that that foal comes out fast, because we know that in order for that red bag to happen, that there's some sort of premature placental separation. So they are already going to be under an oxygen starvation. And also, if that star doesn't burst on its own, they're also not going to be able to breathe that. Even if the head gets out, it's not going to be able to breathe through that thick placenta. So that is why I like to have scissors on hand, because if you have a mare who's had a red bag in the past, then they're slightly considered to be more at risk for having it in the future. And those horses, I will literally take a pair of scissors and tape it to the stall, so that if someone sees a red bag on the camera or when they're observing it, they can literally run in, grab those scissors, and cut that bag open. And it doesn't have to be scissors, it can be a knife, it can be anything sharp. You just want to get that bag open because you want to be able to get that foal out to be able to actually breathe air as fast as possible. So the red bag, everyone has to be aware that is going to be watching the foal what a red bag looks like. So it's important, if you're going to be doing a rotation with people besides yourself, that you kind of make them familiar with, okay, this is what we're looking for. If this happens, this is what you do. That is one of those, if it's a red bag, you can call the vet, but you need to be able to fix it yourself, because by the time the vet gets there, even if they're right next door, you might start to have some problems with the foal. So red bags don't happen all the time. They're relatively rare, but it's good to know in case it does happen, because it's one of those things that can be very easily fixed by someone just watching. So once the foal is actually born, so baby came out, wasn't a red bag, everybody's happy, things really stinking cute. What are the next steps? So we have a very important, we call it the 1, 2, 3 rule. So every horse owner or broodmare owner should be familiar with the 1, 2, 3 rule, because if they don't meet any of these kind of timelines, then it's considered abnormal and could indicate something more serious is going on. So the foal should be standing within an hour. So most foals will kind of lay there for a little bit and then kind of shake around and kind of make some attempts, and they might be a little bit unsteady on their feet for a little while, but the vast majority of them, if they're normal and healthy, will be up and standing on their own without assistance within the first hour of life. If we start to get to like an hour and a half and they've made some like really good attempts but aren't quite standing up, they might just be a little bit on the slower side, so I don't get hugely concerned. But if we get to 2 hours and they can't get up, and then we start to get more and more, then it makes it more likely that it's something significantly wrong. And it could be a mechanical issue. If a foal is born with contracted tendons, so their legs can't really fully straighten, they can have a hard time standing up. On the opposite side, if they're born with tendon laxity, where their joints are too lax and they kind of bend too much, they can have a hard time standing up. Or if they did have some sort of oxygen starvation during birth, they might have what we call be a dummy foal, where their brain just isn't quite acting like it should and they're just really slow and not progressing normally. Those we can sometimes fix with some simple things on the farm, but some of those guys do need really intense hospitalization. And the red bag delivery is a perfect example of, if that is caught in time, you can have a perfectly normal foal. If that's something that the mare is not being watched and they had a red bag and it took them like 20 minutes or so to get out of the red bag or for it to finally pop, you might have an alive foal, but there might be a dummy foal with some mental things that might need some really serious intervention. So a foal should be standing within hours, so that's our 1 rule. And then going on to 2, it should be nursing within 2 hours. Now this one I'm a little bit more flexible on, because there are some foals that are just a little bit slower on the uptake than others, and it seems to be sometimes the colts are usually a little bit slower than the fillies at really getting to the nursing thing. But by 2 hours they should really at least be making a strong attempt. They should be standing, they should be searching for the nipple, they should be reaching, trying to grasp on the nipple. If they're just having a little bit of a hard time finding it, or they're accidentally locking on to the mare's stifle and trying to suck on her stifle instead, I give them a little bit more time, because some of them, as I said, are just a little bit slow. But if we start to get to 2.5, 3 hours and they aren't successfully nursing, then we might get a little bit worried that, okay, why can't you nurse? Why aren't you nursing? But my biggest thing, if they get to 2 hours and they aren't really interested in nursing and they're not trying to nurse, or they'll make like a half-hearted attempt to nurse but never quite get there, then I start to get more concerned that there might actually be something wrong with them. So then that's our 2. So then our 3 is at 3 hours, the mare should pass the placenta. So this is something that is a lot more critical than some people realize. Again, unlike cows and other farm species that can have a retained placenta for days at a time without issues, mares can be very, very sensitive to retained placentas, and if it's in there for longer than 3 hours, it's considered retained. If it's retained for too long, you can actually get some bacterial growth in the uterus, and it can start to release toxins, and they can have an endotoxic shock essentially, and they will get a fever, and they can develop laminitis, and they can develop an infection in their uterus, and it can be really, really serious. So we try to get that placenta out as soon as as close to the 3 hour mark as possible. Sometimes it just needs a little bit of help. There are some really cool tricks where you can where we put a very long catheter up one of the umbilical vessels, so one of the big wide kind of tube structures hanging out, fill that with a bunch of water, and it just kind of expands it and it pops out. Or it might need what we call uterine lavage, where we put a tube into the uterus and basically fill the uterus with water, let it run out, fill it with water, let it run out, and that will kind of loosen things to come out. And then depending on how long it was stuck for, if it came out in one piece or not, then they may or may not need to be on some antibiotics and anti-inflammatories afterwards. But that 3 hour, again, if you get to 3.5 hours, it's considered abnormal. It might need some of the umbilical vessel catheterization. If we get to 4, 5, 6 hours, then we might need some more interventions, because as I said, it can lead to laminitis, which can be very serious, and some other unpleasant things for the mare. So speaking of the placenta, once the mare passes the placenta, it's also very important for us to examine it to make sure that it all came out in one piece, because sometimes it can get stuck in the body, in the uterus, in one little spot, and most of the placenta will come out, but there will be most commonly the tip of the uterine horn that the baby wasn't in. We call it the non-gravid horn. The very edge of that placenta, if anywhere, is going to get kind of retained, even just a piece. It's usually there. Again, it's not common. It's not seen a lot, but it's still something that if it does happen, it can be very serious. So we do like to look at it and make sure that it's all there and it came out in one piece normally. So some other things that we keep an eye on for the early foal's life is the umbilical cord. So it usually kind of breaks naturally when the foal's kind of flopping around attempting to stand up, and that it will break naturally pretty close to the abdominal wall. If it doesn't break on its own, I don't like people to go get scissors and cut it, because when it breaks naturally, it breaks from stretching, and that stretching action is what actually causes some of those blood vessels to kind of recoil and shrink back, and that's what stops them from bleeding. If you take the umbilicus and just cut it sharply with like a knife or a pair of scissors, you don't get that same stretching of the blood vessels, so it's more likely to bleed, and maybe even more likely to lead to some sort of patent urachus situation. So it's much better to kind of cup the abdomen, kind of hold where the umbilicus is against the body wall, and just kind of break it gently, just kind of tearing it. You don't want to yank it like a lawnmower starter, but usually they'll kind of break on their own. If they are dripping some blood, they do make these little clamps that you can put on there, but most of them just kind of break on their own without issue. The umbilical stump, so the umbilicus needs to be dipped. As we talked about, you can get a little Dixie cup, fill it like halfway, 3/4 with your disinfectant of choice, either chlorhexidine, which is what I like, or betadine, and you literally just take the cup, kind of put it up against the umbilicus and just kind of shake it around so it splashes, or you can fill it all the way up and literally just dip it. I kind of like the shaking to make sure it really gets up on there. Some people go a little crazy and like to dip it multiple times for a day, for like a week, and you can actually irritate that tissue if you do it too much. So I like to do it daily for just the first few days, and then once it starts to look kind of nice and dry and starting to shrink down. Another thing is if you dip it too much, then it's always wet, and an umbilicus in the first few days of life should be nice and dry. If it looks wet, it might mean there's an infection, or it might mean there's urine leaking out of it. So I say once a day for the first few days should be fine, and hopefully you have a nice clean stall where there wasn't a load of bacteria that got on there first. So we talked also about having a flea enema in your kit. So foals should, within the first few hours, pass their first bowel movement, so their first little bit of manure, and it's called meconium, and it can be kind of like really kind of thick and dark, and has a very distinctive look to it, and that should pass within the first few hours. That's essentially a collection of like semi-digested material from them being in the uterus. And if they don't pass that in the few hours, you can give them a flea enema to kind of help it along, because it can be quite sticky and sometimes difficult to pass. If they don't pass it and you don't give them an enema and it becomes a true impaction, that can cause colic. It's a pretty, if you have a colicking foal, which will be rolling around, acting painful, meconium impaction is one of the most common things that can cause that. So just make sure that if you don't get a full resolution with a flea enema, so if it doesn't pass the meconium after the first one, don't do repeat flea enemas, because they can actually be a little bit irritating to the mucosa, so they can be a little bit too strong. There's different ways that we can talk to you about doing like a warm water and a little bit of soap enema that's a little bit more gentle than doing the flea enemas repeatedly. So they should also have, as I mentioned before, once the foal is out, kind of start thinking about, we need to do a healthy foal exam. So one of the most important aspects of the healthy foal exam, besides just kind of checking them over tip to tail, checking on the mare, making sure there's no kind of subtle pathologies or something that went wrong during foaling, or there's some congenital issue like some congenital cataracts, or maybe they still have a heart murmur, or some. It's not uncommon for foals to actually have a broken rib after foaling if they have some birth trauma. So those are just all the things that we check over, but the most important thing is we can do what we call an IgG test. So when a foal is born, it doesn't have any immune system. Their entire immune system is going to be coming basically from their mother's milk. So that early milk is called the colostrum, and if they don't drink enough of that in the first few days of life, it only really is there for about 48 hours before they start to not absorb it as well, and the mare's kind of transitioning to a more traditional milk. But if they're not nursing very well in that first part of life, or some mares just have pretty poor quality colostrum, so they don't have a ton of antibodies in there, or if some mares will drip milk for a few days before giving birth, which basically wastes all their colostrum. If they don't get enough colostrum intake, it can really predispose them to getting an infection, and an infection in a young foal can be very life-threatening. So one of the main reasons of doing these healthy foal checks is there is a very simple stall side test that we can do where we take a little bit of blood from the foal, run the test, and it will tell us how much of that IgG they absorb. So how good is their immune system? And if it's really low, depending on when we took it, sometimes if we take the blood sample the first day and we're like, man, they really probably just didn't nurse enough, we have a bunch of different options. We can tube them with colostrum either from the mare. If we know that that mare doesn't have great quality colostrum, sometimes we can tube them. So basically put a nasogastric tube in and kind of force feed them some good quality colostrum. Going into kind of more detailed broodmare management, but if you have a few broodmares and you know that one of them has really good quality colostrum, it's not a bad idea to collect some of that and then freeze it and kind of store it so that if you have another mare that has poorer quality colostrum, you can then thaw that and then tube feed the baby, or have us come out and do that. Some people will try to bottle feed the foals the colostrum to if they're not getting really great at getting onto the nipple. I'm not a huge fan of bottle feeding just because the way that they have to stick their head, it makes them a little bit more prone to aspirate. They're not as good at bottle feeding as other species, let's say cows or sheep or goats. Babies actually seem to do better with less chance of aspiration if you bucket feed them. So if you put some of the milk into a shallow pan or some of the colostrum and try to kind of stick their nose in it, they should automatically try to suck that up. So the healthy foal exam, usually I like to do it no sooner than 8 hours, up to 24 hours post-foaling. Kind of another thing that I'm not sure if I mentioned for broodmare management that's really important is you really want to make sure, dealing with immunity, that you get your mares vaccinated prior to foaling. So I like to give them about a month before foaling, kind of the pre-foaling vaccines, which are usually the standard vaccines that we give, like the rabies, the tetanus. Tetanus is really important. If you're not going to vaccinate your mare for anything else, please vaccinate them for tetanus, because foals are really predisposed to tetanus. They are exposed to it as soon as they're born, and usually the only case of tetanus that we see in foals come from mares that haven't been vaccinated. So giving it to them about a month before they foal will give their body kind of enough time to kind of rebuild that immunity that they get from the vaccines that might have petered off since their last dose, and then they can really kind of pack that colostrum with all those good antibodies. So pre-foal vaccines, of course, we're also going to have your rhino vaccines at 5, 7, and 9 months to help prevent abortions. But the pre-foal, which is basically our standard rabies, tetanus, eastern encephalitis, western encephalitis, West Nile, those will really give the baby a much kind of stronger immunity once they're born. So there's a whole lot of other things that we can talk about with actual foal care. If anyone ever has questions with that, this was more of a covering the few days before and the day of foaling, just because there's so many things that can happen quite quickly. So the biggest thing is have an expected date, know when your mare should be foaling, have a plan for how you're going to predict that foaling, whether it's just daily checks. I strongly encourage people to look into these milk calcium testing kits. They can be really, really useful, and then have a plan of how you're going to keep an eye on her. So is it going to be cameras with you watching the cameras? Is it going to be sitting in the barn and watching her? Just basically have a plan. Chances are everything will go just fine, but it's good to be over-prepared and ready for anything to happen than under-prepared and have something that could have been preventable end poorly. So Those are my biggest, most important things. And then the 1, 2, 3 rule: foal should be standing in 1 minute, or 1 hour, should be nursing in 2 hours, placenta should be passed in 3 hours. And of course, if you have any questions, feel free to give us a call, and we're happy to discuss anything with them, talk about your mare, talk about how to keep an eye on her mare. We at the clinic right now do not currently offer foaling services because we do not have the staff right now to do full-time monitoring overnight. We don't have anyone at the hospital overnight, and as we said, that is very, very important for foaling mares. So it is possible that in the future, if we end up hiring more staff or expanding the hospital, then we might be doing some foaling services. But as of right now, we do not offer foaling services, but we're happy to talk to you about how to help set up a foaling situation at your farm, or if you have a mare that you're concerned about, direct you to a referral center that can foal out with overnight monitoring and people on site 24 hours. So unless there are any other questions, I am going to kind of bid everyone a good night, and hopefully they got some good information from this, and hopefully if you have some foals, you'll be cute and healthy and happy, and I can't wait to see them for their healthy foal exam. So everyone have a good night.